Aloha, Hawaii. It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Hello and welcome again to the program. So glad to have you. You know, I promised you before that from time to time we're going to do a departure, and we're not going to scold you. We're not going to do anything to you except share some experiences of some of the other families and patients that Dr. Juliff has helped over the years. Today we got a great case study coming up in a little bit, but I think it's kind of, and I was learning something about our guests off the air, and sometimes we, as you know, Doc, we discover more fun stuff off the air than we do on the air sometimes. So we got to stop doing that. We got to record all of these little thoughts. But in any case, you know, when we in previous programs have talked to people about venous disease, it's this thing that creeps up on you over a long period of time and doesn't usually manifest until you get a little bit older. In that way, it's kind of cruel in some respects, isn't it? Yeah,
because it's very confusing, and most people don't really connect most of the symptoms with vein disease. Mm-hmm. Varicose veins are easy.
Sure.
Everybody knows, gee, I've got varicose veins. I must have a vein problem.
Yeah.
But there are so many other symptoms that are very much associated with this thing that we call venous insufficiency, and people don't know about it. That's one of our jobs, mm-hmm. is to educate and to inform people. That's
why we're here. And let me tell you something else. We have spoken in previous times, and you're going to really learn that today for sure, and that is who gets it and who are the most likely to get it, other than thanks my mom very much because I inherited it. But a lot of times your profession or your life or your work contributes to it if you're susceptible. And certainly today we're going to find that out about somebody who's probably spent most of her life on her feet.
I think she has.
Yeah.
I think she has.
And so that was like a backdoor way that we can introduce our special guest, Sister Joan. Hello.
Hello.
So nice to meet you. Doc told me about you a while ago, and he said, maybe one of these days when we start doing our patients on the program, we can get Sister Joan to come down, because I don't want to say you're certainly not atypical because every single patient is different. But obviously you must have at one point in time thought, there's some things that are going on with me that my current doctors or other haven't done the right thing. So let's talk about your health. First of all, where do you come from?
Where do I come from? Oh, originally New Jersey, way back. The place I left. Yeah.
Mm-hmm. And you're as far away from New Jersey as you can be and still be in the United States right now, right?
Exactly. Came west.
What brought you here?
Well, I belong to the Marinol Sisters, mm-hmm. and they assigned me to take the place of someone who was ill.
In Hawaii?
In Hawaii.
And where were you then?
Where I had just graduated from college. Mm-hmm. So I came out as a 23-year-old graduate from Manhattanville, and I will tell you, I came out knowing nothing, and everything I've learned here.
Were you looking for grass skirts and grass houses and all that stuff?
Well, not so much that. I think mostly I was so amazed at the mixtures of people.
Oh, yeah.
And I love it. Absolutely love it.
Interestingly enough, and obviously I think I might have hit the nail right on the head after Dr. Juliff told me about you, it is safe to say that you spent most of your career probably standing up.
I never thought of it, but it's the truth. I mean, somehow in college you can sit down and teach, but the rest of your life you stand up and you walk around and you have to be right with the people. So
I think, Doc, if some of our folks had those little Fitbit things and whatnot back in their day, and they would be shocked to find out that they're walking 25 miles into school.
Yeah,
right. It's like a marathon, isn't it?
Yeah, absolutely. Yeah, there are specific professions, and any profession that has the person standing up, in an upright position most of the day, that it really enhances the process of venous insufficiency. But especially teachers, because if you're up and around on your feet and you're walking, that's better than just standing still. But those professions where you're standing and pretty much standing in one place, like teachers, hairdressers, pharmacists, that kind of thing.
I'm guessing though with you, Joan, that at the age that you started, You expected that you were going to be doing that. That's what you did.
Oh, you don't even think about it.
Yeah, I
You
wouldn't
just
think.
do
Yeah,
it.
yeah, do it.
And then after school, you're with sports, and you're taking the volleyball team somewhere, and you're
Yeah, I
standing
think
out.
what's kind of neat about that. Maybe you could explain that these schools, particularly the ones you've mentioned, they're really families. I mean, you're dealing with multiple generations of kids.
You better believe it.
And that they have a level of expectation of having a full life, an academic life, a physical life, and a religious life.
Yes,
Yeah.
It's a community and so your alumni organizations are incredibly important.
Oh yeah. What were your main subject that you like to teach?
Well, I started doing all the sciences: biology, chemistry, physics, that kind of stuff, general science. It depended on the students, and you go to a place like Maryknoll School, and of course you do the top sciences, but the other times you might do the more practical sciences.
Well, because I'm wondering if maybe some of that work, some of those things that you did, caused you to take a look at what was going on with you physically.
Oh.
I mean, when you first started as a young 23-year-old, nothing was wrong, right?
No.
In top shape, doing
Nothing
whatever
was
you
wrong.
get.
Nothing
Yeah,
was
yeah.
wrong. No, actually, I had my first medical experience when I was on Maui, so I was already here 10 years. And I began, that was a blood problem, but it was very interesting. No matter what I touched in my body, it would bleed. I would bleed from absolutely every opening I had.
Of course, when you talk in a room with a vascular surgeon and you say it's a blood problem, his ears perk up like, okay,
that's right.
what kind of a blood problem?
And there was a marvelous hematologist in this town. He's since gone to God, Dr. Robert Jim. And he had down in the Pangfrock Clinic. Oh, it's marvelous. And I had both an allergy and a blood problem, and he helped it, and I ended up going to Kansas City to the hematology center there.
Wow.
And got taken care of.
Doc, when you talk about like a hematology center, you're on the cutting edge of the modern way that these things are treated. So it's safe to assume, even though the procedures, which we're going to talk about with Joan later, some of the things that are very nervous about getting vein surgery done, it wasn't the same thing true in just the whole field. That there's been rapid changes, and maybe because of science.
Sure.
All because
sure.
of science.
Yeah.
Not too many ultrasound machines around those days.
Yeah.
Huh?
Well, the ultrasound, and just the ability to test the blood for basically a clotting disorder, I guess is what Joan had.
Yeah.
We didn't have any of that kind of stuff back then. And not only that, there are a number of congenital, genetically predetermined kind of problems with clotting that we know about today. We probably didn't know about most of them back then, so
But
we
what
didn't
I'm
even know what the problem was.
Yeah, but what I was interested is at what prompted the trip to have to go to a special place far, far away from where you were living.
Well, because Dr. Jim himself said, I'm not getting to the bottom of this. And
okay.
I think that's particularly what I've liked with the medical profession, the practitioner, the doctors who can say, there's something here I'm not catching. And his classmate was at the head of the hematology department
I get it.
at
There
the
you go.
University of
Yeah,
Kansas.
yeah.
She later became the dean of the medical school. Dr. Searage, and I became number 16 in her case study, so she thought I was something else.
Okay, now that being said, was it a relief, or did you expect that you were going to find an answer somehow? I mean, you go all those thousands of miles away. Was it comforting knowing that what you had was being able to be labeled and treated?
Well, she found out that I had two things. I had an overactive bone marrow and an overactive spleen. And until I was 29 years old, those two just loved each other.
Yeah.
And the one produced and the other destroyed. The produced, destroy. Until I had a tooth extracted, and I bled too much from that, so they were dutiful.
Yeah.
They gave me a transfusion, and that tipped the scale, and they couldn't get it back on track. So for how many years? From a good 18 years, every 3 months, I went to my blood person, to get my blood count, and they'd watch my platelet counts go down, and when it got down to a certain number, they'd call, and I'd have an appointment at Queens and get a transfusion. So that went on from 1962 for 18 years, and then I was at a meeting in Chicago, and I looked at the map, and my God, Kansas City isn't too far away, and I called her up. And I said,
Wow,
I
this
have
is
some
great.
time. Can
Yeah.
I go see you? Oh, she'd love it. And I went down I rented a car and drove down to Kansas City. And very good. And there used to be Maryknoll Sisters in Kansas City, but they weren't there anymore. So I went to a hotel and I went to see her. And I had with me a list of every transfusion I'd ever had for those 18 years. I said, it's so fascinating. You get a transfusion, and one day you think you can climb the Himalayas without a Sherpa, and the next time a 10-ton truck ran over you.
Isn't that interesting, Doc? Because we've touched on this before. The blood outside of, just traveling around is full of nutrients, and it's bringing them all over the place. Mm-hmm. So if you got good blood, you got good energy, you got everything else.
Yeah.
But did you find it interesting how long this condition was dealt with before other things were tried? I mean, to me, it doesn't sound like going every couple of weeks to get blood. It's not a fun thing to do.
Well, and that's again, it goes back to did they have the ability to really treat the underlying cause?
They didn't know what it was.
And it sounds to me like the spleen, like you said, was overly active. We've got a name for that. It's called hypersplenism. So what did you ultimately have done to fix it?
Well, this was so interesting. The only thing I told her was the variety I had, and I gave her my calendar. You remember those books that used to have a zipper around, and they had loose leaf pages? And I had written, every 8 or 9 months when I'd get a transfusion, what it felt like.
Uh-huh.
And she was fascinated. So she took that off and copied it. She said, I'll get back to you. And 3 months later, Dr. Jim said, we're going to do something different. We're going to take a unit of blood from you every month and freeze it and give you
and then give it back to you.
Your own blood
Wow.
and your own serum. And I would get those transfusions. I got them for 3 years and never felt like I had a transfusion. It was my blood back into
but
me.
maybe I hope that in our audience, and by the way, you're going to be able to learn this more about Sister Joan, and you're going to be able to hear this episode on the website, veinclinicsofhawaii.com. We'll tell you how to hook up with that later. And that's just a good idea to know that anyway and look through some of the things. But I'm fascinated because, my sister, when I was little, kept a diary. And then the diary became keeping a journal. And it looks like that you did. And that thing that you were talking about, I remember they were called, like the Dale Carnegie had the daily planners.
That's
and your
right.
whole life was in that book.
Yeah.
But you wrote these things down. Doc, isn't that sort of unique in a patient to be able to chronicleize something so accurately?
Yeah, I don't think most people do that.
No, I could have.
But it's great.
Yeah.
It's interesting and probably benefited you in the long run by them being able to look at the patterns
history,
and whatever and put it all together.
Okay, now, however, what we're talking about was decades ago from today.
That was back in the 70s. Yeah.
So that means that.
But you've got me interested now, Joan.
Me too.
So you did the just straightforward transfusions for 18 years.
18 years.
And they were giving you basically platelets.
No, I thought that was true, but they really weren't. They were giving me whole blood.
Whole blood.
They were giving me whole blood, and she said afterwards that she would never do that again. So lately,
is it because Joan? Is it because it's not as valuable as just doing the platelets?
No, it has too much stuff in it. You don't need it. You don't need it.
So you were back then. Nobody ever told you that you were also anemic. All they said was that your platelet count was low.
Well, that was the primary thing. That was the thing that they focused on was the platelet count. And then once that number got settled, once I took my own blood back, it never has gone down ever.
So, but then you had what we would call auto transfusions for 3 years.
3
you
years,
said?
yeah. Mm-hmm.
And then at the end of that 3 years, then
once she saw that it never moved, she said, "That's it."
Yeah. So was it? Did you need to get weaned off it, or did you just stop?
No. Well, I finished a cycle. I guess they had taken the blood. In 1982 was when I finished.
Okay,
81, 82.
All that being taken into consideration, then
I never lost a day of work.
I was going to say, what did it cost you? And I don't mean in dollars. I mean, what did it cost you in productivity? What did it take away from you? It sounded like it's something you took in stride, but that there was maybe nothing else going awry in your body.
The rest of my
at that
health
time.
has been
Yeah,
fine.
that's what we're getting at. Sure.
No, but it was. I guess I learned as a child, if they tell you to do it, do it. You know, and to follow the directions. And I really did. I followed the directions, and I watched certain things in my, you know.
Joan is a perfect patient. She pays attention. She writes things down, and she does what you ask her to do.
I also think that maybe your environment was a big help to you because you were probably in a fairly structured life.
And
you know?
I didn't say to you yet that I came out here thinking I was only going to be here a year and then go to medical school. I have a fascination.
See, Doc, we're learning something here.
See, I have
Dr. Joan is going to be.
Yeah. Well, I'm a doctor that way, but now I'm a doctor in other things. But seriously, I've always been fascinated with medicine, and we have many Maryknoll sisters who get trained to be doctors, and that's nice. And sometimes they think MD is mighty deity, but other times they're pretty good.
Okay, so but I'm still fascinated because during that whole time, your other general health was good.
Yes.
Yeah. So I'm guessing, and Dr. Julep, that maybe when a patient as good as she was as keeping record and everything was being treated and feeling okay, so you wouldn't look anywhere else.
Well, probably not. I mean, not for that problem. Yeah. So, you know, I think you were lucky, Joan, in that, you know, you went
ways
through.
In one.
Yeah.
It was, you know, it was a number of years, but it resolved itself. Not quite sure why it just resolved itself, but it did, and that's great.
One thing that I meant to do in the very early stages, when we found out that Joan's from back east, was there any family history of venous conditions or varicose veins that you knew of?
Not that I know of, no.
Yeah.
Any experience that I learned from other Maryknoll sisters, older women than I was at the time, and they would have the surgery or they would have the problems or, you know.
Yeah. And, Doc, I'm guessing that those people would have been in some sort of real illness stage of varicose veins.
Yeah,
probably.
And so therefore, maybe it was a path well taken that as these gals, in your cases, these nuns, these sisters, as they became affected, there would be this natural thing. Oh, you're going to our doctor, and you're going to get treated and come back in and tell the other gals, okay, your turn.
Maryknoll has a very good health program.
I'm guessing,
It really is good, and we're all insured wherever we work, or if they have insurance.
Was there any family history of blood disorders like the platelet problem?
Well, the story is that there was something in my father's family, but my father died when I was a child, 20 days old, so I don't really know that for sure. Yeah,
because often that
there was no Ancestry.com back in those days, so you can find all this stuff out.
Except he did it for the people. He really was one of the forerunners, my grandfather.
But I think that's interesting only because we've learned, you listening to the program, that a lot of venous problems, you inherit. But that doesn't mean that you have to suffer nowadays. And so I think that maybe it would be interesting, Joan, for people to learn what you knew about the other sisters there that had this surgery and what sort of either did it scare you? Were they hurt? Did they get laid up for a while before they could go back to activities?
Not so much scared me, but it was extremely painful.
Boy.
I got
in what period of time are we talking about that you first started seeing your fellow
would
sisters?
have seen the first varicose resection maybe in 1971, 72.
Resection.
There.
Help me, Doc. What's resection?
Well, that would just be vein stripping.
Okay.
Surgical vein stripping.
A nice way of saying ouch. Yeah.
And then not ever really getting over it. I noticed that they were never able to walk the right way afterwards, or they didn't seem to be as healthy afterwards as they were before.
Wow.
I'm just generalizing that.
I think, though, Doc, we have to make sure that the audience understands today when you get treated for venous insufficiency, that vein will not bother you again because it's gone.
Right.
And so as long as you can see other circulation happening in that limb, it's a way to keep going, keep the treatment.
Not only that, you can walk out and do everything that day. I mean,
isn't that something?
I couldn't get over that.
Yeah.
Good job.
What now? That really, and that validates the surgeon too. I mean, you're in, and every time you go to the office, you got to what on a scale of 1 to 10, what's your pain today, or where are you? So you know these things. But okay, so all those years ago, you got dealt with the blood thing. You started taking the thing, and then you stopped because your friend
fixed.
told you you're fixed.
Really?
That must have been a relief.
Oh, yeah.
Okay, so then what happened medically?
Well, then nothing really seriously happened until I got the most god-awful case of viral pneumonia.
Aha.
And it was not nice.
Yeah.
And I guess I came very close to dying during that time. And I had driven myself to the emergency. That's when you're really sick.
Yeah.
And I know it from the seasons of. I got sick on Palm Sunday, so I missed Easter. I missed all afterwards, and I really didn't come up for air until I don't know, maybe 6 or 7 weeks later.
It's and Doc, we've talked about this a little bit before, and that is that when your immune system is down or when you get sick, and as we get older, then the doors open for all kinds of other problems.
Oh yeah.
I mean, everybody's heard about when somebody fell down, broke their hip, and then all of a sudden they got really sick after that. Not from the hip, but because they just were no longer able to have an immune system that was keep them healthy.
Yeah. In mobility too. I mean,
there was a terrible flu epidemic when that occurred here at Queens, and the doctor in emergency asked me all kinds of questions, who I lived with, where I lived, and she said it would be safer for you to go home and recuperate at home
instead of saying, isn't that interesting?
Staying in the hospital.
Yeah. Mm-hmm. Now, I do know, Doctor, today, it's the first thing in the hospital wants to know is who's got what. And, they already know that you have to either isolate or keep people apart.
Sure.
But was it a problem in those days? Maybe because there just wasn't as much knowledge as the way these different maladies interact with each other?
Yeah, I'm sure that that's definitely the case. But, viral pneumonia was a good thing that you were able to go home because, a lot of people, viral pneumonia can take on a huge spectrum of, clinical kind of ramifications. And some people get very, very sick with viral pneumonia and get placed on, respirators and all that sort of thing.
So that was a scare. You didn't need that.
Oh, I was more than scared that time. I really.
Were you able to take stock afterwards, and were you able to determine that you got 80%, 90%, 95% back of yourself back?
Yeah, and I watched what I was able to do in terms of activity, and it got better as time went on. But when I first came up and started walking around, I felt like a weak puppy.
Were there others in the nunnery with you?
Oh, sure, yeah, and they were wonderful. They were lovely, but fortunately, my room was both near the bathroom and the kitchen, so I could get up and feed myself or get stuff when I needed it. But basically, I rested more those 6 weeks than I've ever had in my life.
What we get concerned with, and we'll talk about this a lot on the show, is people, as we're all aging, that try to be at home and take care of themselves when they got some of these issues. For instance, Doc, when we talked about it before, way not cosmetic. We're talking about when people have the propensity to get a clot. They got to know that pretty quick. You can't just say, this has been bothering me for 2 weeks.
Right, yeah. You have to have the ability to kind of recognize potential problems, know something is potentially wrong, and then act on it, Yeah. Nothing is ever served by ignoring, health issues.
Okay, so there we go. Where you recovered fairly well. Are you able to go about your business and keep going? And so feeling, I would imagine, relieved and so, okay, I'm good now. What happened?
Well, the emergency room doctor happened to be a pneumonologist. I didn't realize that, but she was working with lungs, and that was good. So she said to me, viral pneumonia always leaves a calling card in the body.
A track, yeah.
And it'll attack one of your major organs, so you just be aware of that. I never saw her again, but it ended up that I got what I guess they called lymphedema from that, and the rest was history. It started out, and then I happened by chance to go and give a lecture in Germany at a friend's place, and that happens to be the lymphedema capital of the world, and they really knew what I had, and it was very interesting. But I didn't quite get that knowledge back here.
You know what? I'm glad you said that. And folks, Dr. Juleff, the medical director of VeinClinicsOfHawaii.com, you've talked about that before, and specifically the Joan's talking about Germany, not just the place where the compression garments were, I guess, developed and really, really gone forward.
They were.
But it sounds like that part of the globe had a specific interest. Maybe the medical schools or maybe the doctors, that this is an issue that they probably had a better handle on than anybody in the world.
They did,
I do believe.
especially back then. And I'm not exactly sure what the reason for that was. But yeah, the European countries, especially Germany and also the French, were very
Swiss.
much in tune with not only lymphedema but also venous disease.
Yeah.
And they had a much higher level of interest in further defining the whole process and trying to develop ways to treat it. And in many respects, they were more advanced with respect to those two disease processes than what was going on in the United States at that time.
So, sister, that was a lucky deal for you.
It was ideal.
Yeah.
And I might have gone back to Germany had I not had this other little challenge of taking care of one of the sisters in my house, which I did for 4 years. And when I was doing that, I wouldn't travel except with her. So maybe I would have done that first.
So, Joan, that was really the first time then that you started to recognize and have problems with swelling in your legs.
That was it.
After that episode of viral pneumonia.
That was it.
And how old were you at that point?
Now, don't get out your calculators and try to.
No.
I'm talking to the audience. Don't get out your calculators because what we're covering here is many decades.
Yeah.
And so I think it's kind of interesting because of these symptoms, and then so that would have been probably 5 or so years after your other blood issue.
Oh yes,
had
it was
been
way
healed.
after the other blood got settled.
There you go.
Because I was finished with the blood disease in 1983, and everything else was not connected with blood. This would have been in 2000. I bet 2002 or 3.
Oh, okay. So not that long ago.
Yeah,
not that long ago.
Relatively.
Yeah.
Yeah. Okay. Well, that's interesting.
18 years.
I didn't. Time flies when you're having fun.
16 years. Yeah.
I didn't know that aspect of your story, that your swelling and edema issues of your legs happened or started after that episode of viral pneumonia. But
is it safe, doctor, that people are listening right now and they say, "Well, I have edema. I'm swollen. Do I have venous insufficiency?" I mean, isn't that certainly one of the bellwethers, right?
Oh yeah. Sure.
It's got to come from something.
Yeah. So then that's what I'm getting at. So you started noticing the swelling, and what did it slow you down? Was it painful?
It was not painful. I don't think I have a good pain index. I'm probably not a good one to answer that question, but it was more annoying than anything else. And I tried to make a joke and say, well, they don't accept me I can't go to the New York Ballet anymore. They won't even let me audition. And I'd throw it off, but I realized that I was wearing muumuus all the time because
Isn't it in some respects, and I'm sure you've had discussion with others, we all try to feign off what's going on,
Sure.
I heard something on TV, on radio the other day where some little kid's in a grocery store and says to the clerk, you have a python wrapped around your legs. He says, yeah, but it doesn't really bother me. So I'm thinking that sometimes you just justify out
that's
something.
Right. You dismiss it because you don't pay attention to the distress. At least I don't.
So, for my interest, Joan, when you were in Germany, and that was when you first started having, I guess, the swelling in your legs, right? What did they do for you there?
Okay, every day I had a treatment, every day, Monday through Friday. And this place that I was at belongs to my friend's family, and it's like a spa. It's like a health spa. And it's only 20 miles away from the medical school that has the specialty in lymphedema in Bad Sackingen. And my friend is the one who noticed it, Dr. Renata Rose, and she said, "We'll do something when you come to Germany." So they massaged me, but they didn't wrap it then. They just massaged. And also, I probably got more lateral rest than I had gotten in my life.
Lateral rest.
Lateral.
In bed.
Yeah.
I mean, because it was kind of a health spa, so you didn't do anything at night. I mean, it isn't like you
not down to the disco or having 8 glasses of wine or anything.
Right?
Mai Tais was not part of the diet.
And very, very healthy diet. Yeah. In fact, almost, not totally, but almost macrobiotic diet that they had for their patients. And this was big enough to have like 25 patients. It used to be a little motel that was converted to a health spa.
So it was sort of a spa type setting, and they made use of, probably organic things and massage and et cetera. Did they ever talk to you about potentially having vein issues?
No, nobody said anything about veins then. It was when I was reading something once and discovered, wait a minute, you got veins in your legs and you got swelling, maybe that's connected to, and that's really what made me realize I should do something more, because it wasn't getting any better.
Well, just by the way, gang, I want to remind you to go to the veinclinicsofhawaii.com, and when you get motivated, and hit the contact us button, because what happens is, if you start taking a look at this, and I guess where I'd like to go, Doc, is that it's really wonderful when a patient can isolate these things and say, I read something here, I heard something, but more importantly, I want to do something about it. So that must have meant that some of the activities that you wanted to do, you weren't able to do because you were not comfortable.
You better believe it. Yeah. And I had known from my experience with older nuns at Maryknoll that if people didn't pay attention to stuff, they were the ones that ended up in the wheelchairs. And
there you go.
Thank you kindly. I don't want to do that.
Yeah.
No way.
Yeah, so, and what we're doing, gang, Sister Joan is our special guest for a two-parter. And later on, in the second part of our show that you'll hear next week, we're going to actually talk about the relationship that developed between Joan and Dr. Juleff and the Vein Clinics of Hawaii. Because I think that it's kind of, deja vu all over again. When somebody finally finds a professional, that must mean, before we even get to that, is that maybe, Doc, you can find out from Joan, because I don't ask the right questions, what other health issues presented during the time that ramped you up to where I'm going to go to the Vein Clinics of Hawaii?
Well,
I don't know. I had chronic high blood pressure, which ran in my family when I was in my 50s, and I expected that. But it's not real bad, but it was medicated. But it really was my primary physician, Dr. Goshima, who evidently went to either a workshop or some kind of a explanation about the vein clinics. And he said to me, I think you should go there. So he's the one that recommended me to go, for which I was very grateful. And I had taught him in high school, so I figure my benefit.
Here, for you listening to the program today, is where you ought to notice something. We've talked in the past how a GP has become a quarterback of a football team, and you got to find the right player to carry the ball, the next thing. Isn't that a great example where a GP or somebody will say, you know what, there's more to meet the eye here. You need to see a specialist.
Yeah, absolutely. Yeah. And we get a lot of patients from their primary care physician. And it's nice to see that, because we do fight, the idea that, most people and even some physicians don't always connect all of those symptoms that we were talking about before with this problem. And luckily Joan's doctor did. But swelling is one of those symptoms that, again, people don't necessarily connect, with vein disease.
Is it also true, maybe, Joan, that not as many people see that because either in the nunnery with the garments and things, or in your case, what you said, a lot of muumuus, but maybe you were in an environment where, because that was going on with so many other people, that you just got yourself ready for it, because that's a progressive thing. See, I'm worried about, Doc, a lot of patients that are listeners that weren't surrounded by like people with like conditions, and they didn't learn anything.
Right.
You know, they had to do this all by themselves.
Right. And then the other thing is not only in the the situation that Joan was in, but this kind of thing runs in families too.
Yeah.
So it's very easy for second generation to say, oh well, yeah, my legs are always
Yeah, well,
swollen.
that's the moms are like that.
Yeah,
Yeah.
exactly.
Piano legs, they used to call it.
Yeah. Well, see the thing is, in many respects, and I mean without being too corny or anything, but I guess your family became the other sisters. I mean, you folks were a family.
Yeah. That's right. Burial sisters are my family in adulthood, sure.
Yeah, and so I mean, so you couldn't necessarily catch a disease from them unless you got the flu when they had the flu. But it still must have helped.
Oh.
And I think where I really wanted to talk about a little bit, we've talked on the show before about my own vein issues and my own conditions that I've had treated, and my mom's, who was a businesswoman on her own, standing on her feet all day. She was a model and a store owner, and had horrific times where she would miss weeks of work because of the kind of stripping that you know about that happened to other folks 50 years ago. And so that is something you did not experience, I'm gathering.
Right. No, not fear, but the only anxiety I've ever had is I come from a family that had a lot of strokes.
Aha.
And so I'm aware of that. And that's the reason why I watch the blood pressure thing. And, you have some reason. I learned somewhere along the way that the fifth commandment of the 10 says, thou shalt not kill. Well, I think I learned that you can kill yourself by being stupid about your body.
That's really good. Doc, we've said this almost identically before, huh?
Sure.
Be in denial. It's not a half full glass; it's a half empty glass. You just don't think about it, right?
Yeah. And a lot of people go on with their life doing a lot of bad things to the body, and they don't stop to think about the potential problems.
Yeah, and when we did a show not too long ago called The Myths, and we're going to revisit some of that. But one of the things that we have discovered, and I got a question about this, and that is that maybe also in your life, among the other sisters, your routines, your diets were similar. I mean, was it, community shopping and community kitchen, and people pretty much ate the same stuff. A lot of people ask Dr. Juleff, and I've heard this many times, well, just give me the right diet to go on. We find out that it may not have anything to do with your diet. Probably doesn't.
Yeah, and diet probably won't have an impact anyway. Yeah.
But that means that, and I'm just curious as to other things, and that is maybe some of the ladies also had either type 2 or regular diabetes, and when you put all of those things together and you're covering it all up and nobody sees, then it must have been sometimes when people say, Sister Joan or Sister Sally, there's something going on in the back of your leg. Do you know what's going on there? Has that ever happened?
Oh, it has.
Yeah.
And it's interesting. We've had some people, it's a completely different thing, but topical cancers that nobody sees because we're dressed all the time, and we're only undressed in our own rooms. Mm-hmm. And one of our sisters had a really serious growth on her back of her shoulder, and nobody saw it until it was too late. Couldn't take it out.
So Joan, you were in Germany. And they did the massage and other things to help your edema.
A pill called Lymphocyte, which I still take, and I don't know, but
did that seem to help?
Who knows?
Yeah,
I really don't know that it helped, but they gave it to me and I took it.
Yeah. So then you came back, obviously home.
I went 3 different times to Germany.
You made 3 trips over there purpose?
No, I went there to lecture.
Yeah.
And actually in Zurich, the place that I go to in Germany is only 10 or 15 miles from
but
Switzerland.
Over what span of years would those visits?
This would have been from 2006 to 2012.
Okay, so over a 6-year period, 3 times.
Yeah, 3 times, Mm-hmm. And now that Sister Rosario has gone off to God, I have an standing invitation to go to Germany if I need to.
When you did that, just out of curiosity, so our listeners, because they're saying, what was she lecturing on all the way over there in Germany? What were you doing there?
Well, my profession, because I didn't go into the medical part, I went into a thing called sociology of religion. Mm-hmm. And I keep saying, if I'd been born in Beijing, I would not be a Maryknoll sister. I would hope I would be a very good Buddhist or a very good Confucianist. It's who we are. And kind of the beauty of knowing that our humanity is very, very common. And as a teacher, I love to give out a piece of paper that has maybe 10 quotes, and the students are supposed to say, okay, this comes from, and they know this is the gospel, this is this, that, and the other thing. And not a single thing is from the religion that they know. It's all from Native Americans or Buddhists or Hindus or Sikhs or Zoroastrians. So that's my profession.
So,
Interfaith.
so then after,
interfaith stuff is fascinating, isn't it? Yeah.
during that time period where you were going back and forth to Germany, then you would come home, and would you do anything or continue any therapy for your legs at that time?
Well, I don't know if it was real therapy. I certainly took the lymphocyte, but what I tried to do, they talked me into getting this contraption. Honest to God, $10,000 worth of equipment that goes on you. It has a big long zipper. It goes on both legs from toe to groin, and to put that on every day.
That I heard about one of those, Doc. When we first met, I said I heard about one of those things. Scared me to death.
Yeah,
and I'm not going into that thing.
So that was a compression device.
Yeah, it was a compression device, and it's very fascinating. It starts at the toes and the ankles, and then the calf, and then the thigh, and it's very nice. It's not painful. It's pleasant, but it's, for want of a better word, it is so time-consuming.
I was going to say,
right.
It sounds like you really have to make a commitment.
That is one of the devices that we use all the time for, especially lymphedema. But you're right; they're not. It's just
not
inconvenient.
user-friendly.
It takes a while to put the device on, to set it up, and then you have to be laying down, and you got to do that for an hour, a couple times a day, and it takes a huge, divot out of your day.
People think that you're not doing anything, so you can do that for, like they just asked me not too long ago to do from the wound clinic 6 times a day to have your feet up for half an hour.
Yeah,
I don't sit that long.
Now and I tell you, we often on this program talk about the value of elevation. But the first thing that I learned from the doc is elevation is great, but the minute you get up, whatever was there before is coming right back, because it's gravity.
Yeah.
And that's why you feel good when you put your legs up. But if you put your legs up for too long, your back starts to hurt. So it's sort of a trade-off, isn't it? But isn't it true that the contraption that Joan was talking about is sometimes an emergency thing that you need to do right away on somebody?
In some settings, definitely, but some form of compression, not necessarily these, sequential. We call that a pneumatic sequential compression device. Not necessarily that device itself, but there are situations where compression of one sort or another is absolutely urgent.
Yeah, I was going to say. But interestingly enough, some of these things are going to end up on the walls in these museums, and they say, look at what they used to do to treat that. Because there's no magic pill, right? We're not going to have a magic pill for the foreseeable future. So somewhere in between that contraption that you had the reaction to and a pill is where we all are today. Yeah. So that being said, that was also in Germany?
Well, it was Germany that told me about it, but I purchased it in Hawaii.
Were any other nuns able to also use it?
No. I mean, if somebody had the condition, they certainly could share it, but nobody in my house has.
Yeah. And were you able to were you able to do that periodically, or was there a period of time where you were doing it daily?
I tried to do it. I really did try to do it once a day.
And do you think that it had a benefit?
Well,
that's my question too. I mean, if you don't get a benefit, I think none of us, you all there listening, go to veinclinicshawaii.com and make an appointment to come and see us, because if you don't believe in the thing, or if you don't get a benefit out of it, it's not going to be done.
Well, that was the problem, really, and to them, my point, it still is the problem. The treatment that I got at the vein clinic was what seemed to be the better thing to get. It didn't take the swelling down all the way, but it certainly was noticeable. The compression garment was interesting and expensive, but not,
and you have to take
the
all
whole
that
thing is
into
expensive.
consideration when we're trying to develop a therapy plan for patients, because you have to throw in the idea of compliance.
Sure. Yeah.
And if some sort of treatment form, it may be the best thing in the world, but if people aren't going to be able to incorporate that into their daily lives, then it's not going to work.
Yeah. Incidentally, and I think many of us have seen this, along the sidelines in a football game today, you have the injury tent. When somebody goes in there to get triage for a concussion or, a protocol. But isn't it interesting also, and I saw this just the other day in a college game where somebody got hurt, it was a leg injury, and they brought that bag out right there. And, they got this guy up in that thing, and they put this thing on it, and they pumped it up, and it got that big, and that they could stand him up and put him on a cart, and he could get out of there. Yeah. Isn't that the modern version of what we're talking about here?
Well, that's one version. I think in that setting, they're doing it primarily to immobilize
exactly,
the guys.
And it does. Right?
I'm sure it does. Yeah. This is a little different because the sequential compression device, like Joan was saying, kind of starts down at your toes and feet. It inflates, and the theory is that as it's inflating up the course of your leg, then it's pushing the fluid upward. So, it inflates longitudinally up the leg, and then it deflates, and then it inflates and deflates.
Okay, so, what did you do while you were doing that? Could you do anything?
Crossword puzzles.
Yeah, okay.
Solitaire. That's where the advantage of an iPad is.
Yeah, exactly.
Very convenient.
Bring me my little iPad.
Yeah.
I'll play solitaire.
And I also tried to back up so that I wasn't totally flat, that I could kind of be sitting up a little bit. I don't like to be all the way flat.
Yeah, and I was going to say,
and many people don't.
Yeah, and it also must be somewhat of a trade. If it's not a good trade, if you're not going to be able to get up right after you do the treatment and feel relieved and be able to do something, I mean, okay, I'll try it once a month, but it was a big tee shot. I mean, this thing's not cheap. They cost a lot of money.
Yeah, well, that's right, and I felt a little guilty about the money for this or the money for the wraps and all that kind of stuff. I mean, it mounts up. It mounts up. On the other hand, Maryknoll is so good that they'll do whatever we need. It's not
whatever it takes.
I don't feel diminished by it, but I don't want to overdo it. And then I feel guilty if I don't use it all the time. And lately, my responsibilities with Rosario, I wouldn't have had enough time to be.
When you said before something, Doc, you can expand on this a little bit. We hear the term wraps every now and again. What type of wraps were you talking about?
Well, it's a kind of a material that has extensions, that has Velcro, and you put it on the back of your leg and bring it around and tighten it,
right.
Which when other people put it on for you is marvelous. But the way our gravity is, it's not as easy to get it tight when you're doing it on yourself.
Interesting.
Yeah, the Velcro wrap that you're describing is one of the alternatives to just standard compression stockings. And even as simple of a thing as compression stockings,
hard to put on.
Exactly.
They are.
Trying to get people to be compliant with those is a chore, and it's not always their fault that they're not doing it. Some people just cannot get the stockings on.
And by the way, it does take some pretty good. I have no problem. I just pop them right on, but not without the little gloves with the knobby things, because I don't care how strong your upper body is. Those things, they are. If they say no, I'm not going, they're not going.
Yeah. So the Velcro wrap is an alternative to a compression stocking. And, so theoretically it's supposed to be easier because you can, put it on the leg and then, put the wraps around. But that's difficult too, again, when you're trying to do it to yourself. It doesn't work out as well as it should theoretically.
Well, I'm thinking there's another thing too. And, nowadays you see a lot of people out in the public, and we've talked about this before, Dr. Julep, a lot, that, at one point in time, sanity outpaces vanity. When you are supposed to wear these things and you're not happy with the way they look, then you either stay home and wear them, or you just say, you know what, I don't care if somebody thinks I look a little crazy. It makes me feel good, right? At least I can walk when I'm wearing these things.
Yeah.
And that's all about swelling, and that's another thing we need to talk about.
Sure. Yeah.
So that being said, as we go down the Jones story, which is fascinating because of the fact that you probably weren't able to take much time off. You still had a full commitment. You give care to others. You certainly have students and lectures and all this. But did you sometimes feel like, what's next? I mean, gee whiz, all these things are going wrong with me. What's next? What was next after this swelling started?
I don't know. I'm still in it right now. I haven't gotten to the next part yet. But no, I'm happy to be 86 and running around and.
Yeah. Even now
you're
very active.
I didn't ask that. That wasn't me.
Yeah,
you didn't
she
ask
offered that,
and I would have never guessed it either. So
I come from a family where everybody said their age all the time, anytime. This over 21 stuff drives me nuts.
So what was the next with respect to you trying to figure out this whole swelling issue with your legs? You had the stint in Germany going back and forth, and then you came here and you tried the sequential compression device, and that didn't work very well. And then at what point did you say, and what did you say to yourself with respect to finding somebody or doing something, finding some other therapeutic modality that was going to help you?
Well, I'd like to see what the difference is. If I go back to Germany, now that I've had the vein surgery, I think that should make a difference. Because I know there's a difference in my legs from...
Isn't that a wonderful feeling?
It
I
is,
mean, after all the experimentation and maybe
sure.
angst and anguish and, oh my goodness, is this worth it? I'm going to really go do this thing? And when all of a sudden you find out, I can go up these stairs. It doesn't bother me anymore.
Yeah.
I know that one of the things that we're going to try to do is, in case we've got you actually locked in, you have to listen to a second show because we're going to break this up in just a minute. And what we're going to do is actually go into, with Joan again, talking about what happened since her relationship developed with Vein Clinics of Hawaii. Because I think that even though you do an awful lot of things there, Doc, isn't this the just a wonderful thing when somebody finds that your passion is going to be able to comfort them or to help them?
Yeah, we see a lot of people with, the full spectrum of, vein issues. And some of them are a fair bit more minimal than others. But especially with a problem like Joan has had, with the chronic swelling that just has been unremitting and, so terribly difficult to control. When we are a part of, bringing about some extent of remedy, that's very fulfilling. It's the same way when we treat people who have end-stage venous insufficiency that have had terrible ulcers and skin problems, and a lot of those folks, like we've talked about before, they can go on for months and months, sometimes years, with skin breakdown and ulceration and not really knowing where to go. And when they come and we help them, it makes you feel good.
And the other side of that, Joan, is probably maybe that you can, amongst the other nuns, is talk about health and everything else. But when you mentioned a while ago that most of the things that you do with regards to disrobing is in the privacy of your own room. And what we're going to talk about in the next program, and just for a moment here, is ulcers. Because sometimes we know that people just put a Band-Aid on that little thing for years before they think, why isn't this healing, Have you been fortunate in that area?
Yeah, well, I could show you some wonderful pictures of stuff on my legs that I...
Okay, what we're going to do is we're going to paint the picture in the mind about that.
Okay.
About some of those things. But I think that maybe the other thing is, and maybe we should spend just a minute, when someone like Sister Joan comes to you, there is a protocol. There is an assessment period. Isn't it wonderful when somebody already, I don't say self-assessed, but they know that they need what you've got?
Yeah. Again, Joan has always been the perfect patient. And when we're trying to figure out what's going on with somebody, the help from the patient means a lot. I mean, there's no question about it. A lot of people come in and they really have not kept track of their medical history whatsoever. But Joan did, and it made things a lot easier.
And that means that this is a perfect time to tell you we're done for now, but you got to come back next time and pay attention. And if you want to know more in the meantime, I'll give you a little hint. Go to www.veinclinicsofhawaii.com. See you next time.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.